Hello everyone, this is part 2 of how to remember for INICET so that you don't commit any mistake. This is true for NEET PG also. You can watch this for NEET PG also. So in last part 1 we had covered pediatrics and we had covered OBG. So in this part we'll be covering surgery and orthopedics, very important forgetting topics. Okay. So here's the first question. 45-year-old with GID undergoes fundoplication. So basically you have to identify which type of fundoplication has 360-degree wrap. Okay. So let's search for surgery mnemonics. Surgery. Okay, so here we have a mnemonic for this, a beautiful mnemonic. See over this. So application mnemonics. So near total, that is Nissens, has 360-degree. Two ped goes on the top of the head like a cap. Okay, so it is only on the top, that is 180 to 270. It goes above 180. Lind is large line at the back. Okay, so it is over the greater curvature. So it is 360-degree. Next, anterior wraps are there. That is doors. Doors fundoplication is like when you open door, it will open 180-degree, right? Thal is 3/4, 3 for thal. Okay, so it is 270 total, 3/4. Watson is what? Just 90-degree. So this is how you remember things. Okay, so now there's no doubt at all. Two-pet is over the top, so it is 180 to 270. Nissen is near total, so it is 360. Watson is what? Only 90-degree. And door opens via to 180-degree. Okay, so here the answer is 360. Near total it is Nissen's. Okay, so this is how you remember. Next question is Peutz-Jeghers syndrome is associated with germinal defects in which gene? Okay, it is given STK11 and which chromosome? So for Peutz-Jeghers, yes, we have a mnemonic over here, that is STK11 and chromosome number is 19. Okay, so STK19. Okay, so that is how we remember chromosome number 19. So the answer is chromosome 19. Next, which of the following defines Carnage triad? So what is Carnage triad, what is Carnage complex, and what is Carnage dyad? Okay, so this is very important so that you don't confuse this. So for Carnage triad first, the mnemonic is GPP. And for Carnage dyad, it is only GP. So what is included in this? So in Carnage triad, we have GPP, which is nothing but GIST, pulmonary chondroma in lung and paraganglioma. You can see the images over here. And if paraganglioma is not there, sorry, if pulmonary chondroma, that is lung thing is not there, okay, you are dropping the lung, then it becomes Carnage dyad. And Carnage complex is exactly different. It is basically this myxomas, lentigens, okay, and TAP overactivity, that is endocrine, testicular, adrenal and pituitary overactivity. So in our question, we have Carnage triad, so we basically need GPP, that is GIST, paraganglioma and pulmonary chondroma. So this is our answer. Okay. Next, patient presents with open tibial fracture with 12 centimeter wound. So this is basically ortho question based on Gastroenterology classification, and this is where many people make mistakes. So let's go to ortho mnemonics. Yes, in ortho we are going towards Gastroenterology. Here it is. So see here, the mnemonic is less than 1 centimeter, less than 1 centimeter, 1 to 10 and more than 10 centimeter. Okay, so our question is basically straightforward, that is more than 10 centimeter. So more than 10 centimeter is already grade 3. So in grade 3, whether it is 3A, 3B or 3C, how to know? A means A is for adequate coverage. So skin adequately covers the bone. B is that bone coverage is gone and we need reconstruction. There is bare bone. And C means there is critical neurovascular damage. Okay, so in our case, there is extensive soft tissue loss that prevents primary bone coverage. So bone is not covered. So that's why it is grade 3B. Okay. So this is how mnemonics make it easy for you. Next question is on Salter-Harris classification. Again, a very common topic, but again you confuse it the most. So how you remember? There are total 5 types, and type 1 you see it is yes. Okay. Remember it as yes. Salter. Okay. Salter is the mnemonic for this. So yes means straight. So it is fracture only through the physis. Okay, it looks normal on the X-ray. So it is only present through the physis. So it is straight across. Okay, so bone appears normal only. So there is nothing available, nothing abnormal on X-ray. Okay, type 2 is above. So above the growth plate. So it is in the metaphysis. Type 3 is lower. L. Okay, L means Salter. L. So it is in the epiphysis. Type 4 is through everything, through both metaphysis and epiphysis, and type 5 is where it is erased, means it is rammed, everything, it's a crush injury. Okay, so here it is asked which of the following is the most common type and which involves the growth plate and the metaphysis. So M means metaphysis. Metaphysis is the most common, and metaphysis means it is above the growth plate, so it is type 2. Okay, next. Child presents with displaced supracondylar fracture, which is a common nerve injury. So supracondylar means above the humerus. Okay, do you have a mnemonic for this? I think yes, nerve damage. So above the humerus. Okay, so in the humerus we have this over the humerus we have radial nerve towards the round shaft. In the axilla we have axillary nerve. Over the radial part we have, over the shaft we have radial nerve, and below that is supracondylar fracture. Over the median part we have the median nerve. Okay, so here it is M. So in median nerve, the most common nerve that is injured is anterior interosseous nerve, then median nerve, then radial nerve. Okay, this is the most common list. Okay, so supracondylar fracture we have either median nerve or anterior interosseous nerve. So our answer is anterior interosseous nerve. Okay. Next, pain at lateral epicondyle. So it is exacerbated by resisted wrist extension. Which elbow this is? Okay. So for this also we have a mnemonic. See here, if it is tennis elbow, the mnemonic is TLE, T for tennis. So tennis is LE, that is lateral extensor. Okay. If it is golfer's elbow, it is GMF, means golfer's elbow, it is medial flexor. Here it is lateral extensor, here it is medial flexor. Next, student's elbow means we have SOB, that is olecranon bursitis. Okay. Similarly, javelin thrower's elbow, we have JOB, JOB, that is olecranon bone. Okay. And pulled elbow, that is nursemaid elbow, we have PAR, that is annular or radial type of dislocation. Okay. So now it is asked lateral epicondyle. So it is TLE, lateral epicondyle, LE. So it is TLE. The answer is tennis elbow. Next, which cast is specifically used for scaphoid? Now, do we have mnemonic for scaphoid cast? Yes, we have mnemonic for all cast. So there are 4 main types of cast that you should remember. One is Minerva cast, that is minor. Okay, so it is basically for spinal cervical spine fracture. Okay, so we give Minerva cast. Next is for scoliosis, we have Risser cast. Yes for scoliosis, yes for yes. Okay, it is also known as buckle cast. Third is for U slab, we have U slab is for humerus, U slab humerus. Okay, patellar we have PTB, PT so for patellar, and PTB means tibia is also included. Next, bachelor's cast is for bachelor's hip, for developmental dysplasia of hip. For glass holding cast, that is basically sipping type of cast. So from glass you are sipping, no? So it is sipping types. Yes for scaphoid. Okay, so the question is which is used for scaphoid? For scaphoid we are using sipping glass. Okay, that is basically glass holding cast. Okay, so this is how you remember. Bachelor's cast is for DDH, and for Minerva cast we have cervical spine cast is Minerva cast. Okay. Next, sensory loss exclusively on the skin of middle finger. This is basically dermatomal involvement, which mnemonic is over here. So middle finger, it is like a stalk, right? So stalk, middle finger, it is a stalk. So it looks like 7. You see on the image, it looks like 7. Whereas thumb looks like 6. See this? So thumb is actually C6. This is the dermatomal innervation. Okay, so lateral shoulder, it is basically a badge like, so it is axillary nerve involvement C5, C6, and damage here causes regimental badge type of neuropathy. Okay, only this area is not involved. Lateral forearm, it is lateral nerve, that is lateral musculocutaneous nerve. Little hand of the finger, that is end, it is basically C8, and in web space of the radius, it is innervated by the radial nerve. So in thumb, it is C6, and middle finger, it is 7. So our answer is C7. Next, bumper fracture. These are basically the named fractures, and do we have a mnemonic for that? Yes, we have a mnemonic. So bumper fracture, so bumper hits the lateral tibia. So our answer is lateral tibia. So the answer is lateral epicondyle of tibia. Okay. Next, management of choice for fracture of femoral shaft in 4-month-old infant. So in infancy and age related, what is the treatment for femur shaft fracture? So up to 6 months we have Pavlik harness. So how to remember this? Pliable babies. Pliable means soft babies. Okay, their bones are very pliable. So pliable, P for P. Second is yes, spica. Spica is yes. Yes means small kids. So from 6 months to 5 years, it is spica cast. Next, for 5 to 10 years, it is flexible nails. Okay, so these are fast moving kids from 5 to 10 years. So flexible nails. And more than 10 years, we have locked nails. Locked nails are basically for heavy kids. Okay, that is large kids. So how to remember? Pliable soft babies. Okay, that is less than 6 months. Then the small kids, that is spica cast. Next is fast kids who run between 5 to 10 years. Okay, for them we have flexible nails, and more than that we have locked nails. So in this case, for 4-month-old infant, we'll go with the Pavlik harness. Next, knuckle bender type of splint is used for which correction? Do we have splint? Yes, over here we have yes. So knuckle bender, see here, knuckle bender is for basically for claw hand. Okay, you remember it as knuckle bender for claw, that is KBC. So claw hand is seen in ulnar nerve injury. So the answer is claw hand. Next, hangman's fracture involves which cervical structure? Again, a very repeated asked question. Jefferson's fracture and hangman fracture. Everyone does this mistake. And also Chance fracture. This I have seen many times. Jefferson's, hangman, and Chance. How to remember? Jefferson, remember it as J1. Okay, J1, just like F1 formula is, we have J1. So it is Jefferson's. Okay, H2, hangman is for H2. Okay, so H2 is pedicles of C2. So that is the answer here. And Chance fracture is CH. Okay, CH is horizontal. Okay, so the horizontal fracture of the vertebra. So here the answer is pedicles of C2. Which type of osteogenesis is imperfecta? See, just memorize this image, just visual memorization. Okay, so what you see in one is green, 2 is red, 3 is orange, 4th is yellow. So that means yellow, second one is very lethal, that is there will be more perinatal death in type 2. Okay, similarly you see the eye color, sclera color, it is maximum blue in 1 and 2. As it proceeds to 4, it is almost normal only. What about height and stature? Only in 2, that is in lethal disease there will be very short stature. In rest it will be only short, and here it will be normal stature. Okay, what is the defect? Everything you go through this mnemonics. Okay, so for our question, which type is characterized as benign, perinatal, and very lethal? It is type 2, no doubt in that. Next, which of the following is considered significant modifiable risk factor for osteoporosis? For this, no need of anything. Smoking, the only modifiable factor. Onion peel appearance, again it's a very common question. Having sarcoma, no need of mnemonics. Which bone tumor is located in epiphysis? This is important. Tumor location and Yes, this is how you remember. See, for epiphysis, remember as GC. Okay, GC is epiphysis. Remember it as gum. Okay, GC gum, which is close to the epiphysis. So you basically have GCT and you have chondroblastoma. Okay, these two are in epiphysis. Metaphysis, remember 2O. Okay, one is osteosarcoma, one is osteochondroma. Two things, 2O. Okay, osteosarcoma and osteochondroma, and then you have aneurysmal bone cyst also and simple bone cyst. These two are also present in the metaphysis. Epiphysis, diaphysis, there are three. Okay, EAO. E is Ewing's, A is adamantinoma, and O is osteoid osteoma. This is the only image that you need to remember. So here it is asked epiphysis. Epiphysis is GC. So GC is giant cell and chondroblastoma. So our answer is giant cell tumor. Next, foot amputation type. This is the last question. Okay, so foot amputation type. So basically it is asking which is a transverse tarsal. So transverse tarsal means basically it is heel. So for heel you have, how do you pronounce heel? You can also pronounce it as cheel. Okay, so cheel means it is choppered. Okay, if it was tarsometatarsal, then it was Lisfranc. Okay, Lisfranc means longer. So you are actually going till here, then you are cutting the doing amputation. So it is Lis, which is equal to longer, that is at tarsometatarsal, which is Lisfranc. Choppered is cheel, which means heel, which is at transverse tarsal. Pirogov is at the pivot piece. Pivot piece is mainly the calcaneum, which is pivoting. Next is Boyd. Boyd is at bibytalus. You are doing talectomy. Supramalleolar, you are doing 6 cm above the ankle, 0.6 cm, and Sarmientio, that is slightly more, that is 1.3 cm above the ankle. This is how you remember it in easy terms. So in part 3, we'll go to other subjects also.